Hey everyone, welcome to the series of treatment approaches for phonological disorders. The topic of this video is the cycles approach. Before I dive in, I want to give a big thank you to Dr. Hodson. Dr. Hodson is one of the main researchers and developers of the cycles approach. So Dr. Hodson, if you're watching, thank you so much for dedicating your career to developing this program and to helping so many children. Also, if you're a person who needs extra visual support, I have added a link down in the description below to a handout on the cycles approach. It's on Teachers Pay Teachers. Please feel free to follow that link and download the handout. It gives you an overarching idea of the program as you listen and follow along. The cycles approach is designed for children who have highly unintelligible speech, and this often ends up being preschool age children. Now, I've included this video in the phonological disorder series, but it could be designed for clients who have much more than just a phonological disorder going on, such as apraxia. I recently watched a continuing education course by Dr. Hodson, and she talked about her preference of using the term highly unintelligible speech rather than a phonological disorder or apraxia because these clients have so many extensive errors and we might not truly understand what's going on until they get a little bit older. The cycles approach is different from other treatment approaches because it doesn't function on levels of mastery. So you're not going to be shooting for a percentage correct, such as like 80% accuracy on the K sound. What you are trying to do is to get certain patterns to emerge in spontaneous speech by targeting certain patterns or phonemes in time periods known as cycles. During a cycle, you might target 3 to 6 patterns or phonemes. Generally, 60 minutes is spent targeting either a single phoneme or a phonological pattern. Now, if you're going to be targeting a phonological pattern, it's recommended that you provide at least 2 examples of that phonological pattern. So, one example could be provided in the first 60 minutes, and then the second example would be provided in the second 60 minutes. When you're choosing targets for this approach, you're going to start by looking at the primary potential target patterns. Now, once those start to emerge into spontaneous speech, you're going to start thinking about the secondary potential target patterns. Let's start with primary potential target patterns. The primary potential target patterns include early developing patterns. This includes syllableness by targeting vowel sequences in compound words. These are usually 2 and 3 syllable words. Then you have the syllable structures like consonant vowels, vowel consonants, as well as consonant vowel consonant words. You'll have S clusters, anterior and posterior contrasts. These are our velar and alveolar sounds. And last are liquids. This includes word initial L and word initial R. Once you know your client's errors, compare them to the primary potential target patterns. Now, if your client is missing all the primary potential target patterns, any one of them could begin your first cycle. Now, something important to consider with this program is that your client needs to be stimulable for the target you chose. The exception to this rule is with initial L and R. You're going to target those sounds at the end of each cycle despite stimulability. As you progress through the primary potential target patterns, you might begin to notice that your client is using them in spontaneous speech, which is the ultimate goal. However, before you decide to move into those secondary potential targets, consider these 3 things first. 1, that all early developing patterns are established. 2, that S clusters are emerging in conversation. And 3, anterior and posterior consonants are being used contrastively. If those criteria have been met, you might be ready to start moving into the secondary potential target patterns. Secondary potential targets are kind of the leftover errors that your client has. So this is going to be individual to your specific client. Now, Dr. Hodson mentioned that at this point in treatment that you could start to incorporate minimal pairs into your treatment approach. The secondary potential targets include vowel contrasts, non-dialectal vowel contrasts, singleton stridents, which are anterior F and S, palatal glide, palatal sibilants, other consonant sequences like consonant, consonant, consonant clusters as in the word scrape, or glide clusters as in the word cube, or medial consonant clusters like in the word basket, medial k, post-vocalic and syllabic R, and assimilations. Now that you have an idea of the potential targets, we're going to talk about the session structure. Now, just as a side note, when you're working with young children, they thrive in routine and consistency, or you're going to lose control really fast. What I love about this program is there is a specific therapy structure that you can build in to your sessions. The session structure for the cycles approach begins with review. Now, if this is your very first session, you are obviously not going to have anything to review. But once you do start getting into therapy, this is the time when you review last session's word cards. The second step is auditory bombardment. Now, for this step, you are going to need some sort of amplification system. I have a personal voice amplifier here. I got it from Amazon. It's got headphones that attach to the amplification system here. I'll put a link in the description in case you guys want to check it out or look for any others like it. Basically, what you do is you put the headphones on the client and then you read them a list of 12 words that have your target pattern in them. The third step is target word cards. This is the step when your client is going to create 3 to 5 target words on large index cards. Now, I would recommend having pictures of the words you are planning to target already printed off so that they can color it. You could also have them ready to cut out and glue. Whatever works best for you with the time constraints you have. You can also have them draw their own, depending on how fast they can do it. Again, whatever works best for you. This is also a time when you can have them repeat the target words based on your model. The fourth step is production practice through experiential play. So have some activities ready so that you can take turns saying those target words with your client. The important thing for this step is you are going to give as much support as you possibly can to make sure that they're 100% successful. This is also a time when you can really listen to your client's speech to see if that target pattern is showing up in spontaneous conversation. The fifth step is stimulability probes. Assess your client for next session's potential target words. Model several words and have your client repeat them. Choose the words that your client is most successful on for your next session. The sixth step is a repetition of auditory bombardment. This is your amplification step where you put the personal amplifiers on your client and say a list of 12 words. The last step is the home program, and this step is vital. So what's going to happen is parents are going to practice at least 2 minutes a day with your client. They're going to read the words from the listening list, which is the words that you read to your client with amplification. Now, parents and caregivers do not have to have a personal amplifier at home. They can just read the list. And 2, they're going to be practicing those target words that you created with your client. And that's it. That's the cycles approach. Now, I know that this program has a lot of information in it, so like I said earlier in the video, there is a link in the description to a handout that outlines this program. Bonus, you guys, I have provided a link to a handout on Teachers Pay Teachers. This is a data collection packet for the cycles approach so that you guys can get started using this approach with your clients. The data collection sheet has a spot for your client's name at the top. Below is a section you can reference for the primary and secondary potential targets in case you need that refresher, like I do sometimes. The tentative plan section allows you to map out your thoughts as you move through therapy. As you're just starting, you'll probably only need to fill out the section for cycle 1, but as you get close to finishing cycle 1, you can start to plan for cycle 2. I've also included on the back of that page more planning spots if you need them. The next page is what you can use for your daily session notes. There is a spot for the date, a place to write which pattern you're targeting, a spot for the 3 to 5 words you're targeting in therapy, and then a spot for the session length. I've also included a page for the listening list. The listening list that you prepare for the auditory bombardment section can be written here. And then at the end of the session, you can easily cut out the list and send it home with the parents for weekly practice. Also, don't forget to send home those 3 to 5 words with the parents to practice. I hope you all found this video helpful. If you have any questions, comments, concerns, please feel free to leave those in the comments below. Don't forget to like and subscribe to stay up to date with future content. Have an amazing day.